the NHS is under considerable pressure. We've had a very tough summer as we have continued to treat people with COVID being admitted to hospitals. As society has opened up again and we've begun to see a return to normal, near normal levels of presentations of urgent and emergent people who need urgent and emergency care. And of course, as we started to make inroads into treatments for patients whose care has been disrupted and delayed during the pandemic. So it undoubtedly feels exceptionally busy in the NHS, and our NHS organisations are telling us that all the time. Now, in September, we saw a reduction in the number of COVID patients in hospital, down to below 5,000 in England, as infection rates went down, as Jenny showed you earlier. In the last few weeks, those infection rates have gone back up again. And we have started to see, again, as Secretary of State has said, an increase in the number of admissions and an increase in the number of patients in hospital. So now in England, in our main hospitals, we're just over 6,000, as I stand here today, 6,000 patients with COVID, which is back to where we were in the middle of September. And I anticipate that over the next week or two, that number will increase because infection rates are increasing. And as I've said many times, there is a lag between infection rates and hospital admissions. Now, it's not just COVID, of course. We have one eye to the flu season. And we don't know what's going to happen with flu this year, but there is a risk that we will get more flu back and it will be worse than previous years because we missed out a season last year. And there are other viruses around as yet as well. And of course, we are continuing to do all that work around the recovery of our elective and routine services. So it is very, very busy indeed. We work very closely with the Department of Health Social Care around the judgment of how the NHS is doing, and we will continue to do that as we go into winter. But I think the really critical thing is that the public can help us here. The public can absolutely help the NHS here. And as the Secretary of State has said, there are things that the public can do that will take the pressure off the NHS. So the first is to remember that for face masks, there is guidance in place. If you are in a crowded environment, a higher risk environment, on the tube, a building, cramped building with low ventilation, then wear that face mask. It makes a difference, it really does. And the second thing, of course, is the vaccine programme, because the vaccine programme is our best protection against COVID. And therefore, if you've been invited for a booster and you haven't had one, or if you are getting your invitation in the next few weeks, then get that booster as quickly as possible, because we know that the immunity that we get from vaccines will drop off over time. And we don't want that to occur going into winter. So this is not something that we just need to leave. We can get the public to help us on this. And during the last 18 months of the pandemic, I think the public has been fantastic in responding to assist us in the NHS with pressures. And the public can do it again by remembering COVID is still here. We need to be cautious where appropriate, and we need to get those jabs when we're offered them.